just tend to hit different aspects of your hip that tend to get tight and restricted and can compromise how you load up your back. G'day and welcome back to the channel. So in today's video, I want to talk about some really important topics surrounding degenerative disc disease. And more importantly, some things that I think anyone with degenerative disc disease needs to understand in order to optimize their rehab or their progress through degenerative disc disease. So in this video, I want to talk about some really important and crucial information regarding a scan, whether it's an X-ray or an MRI, and what that may or may not mean for your expectations with degenerative disc disease. And then following that, I want to go through 3 really helpful exercises that you may not have done before that I think is really important for anyone with degenerative disc disease to conquer and to improve your quality of life going forwards. So before we get into this, please let me know in the comments down below, how are you going with degenerative disc disease? And also let me know any exercises that you might be doing that you find really valuable, just so that other people who are coming to this video can see that and potentially test them out for themselves. So one really interesting concept that I think is really important for anyone with degenerative disc disease to understand is the relationship between what your scan may show and how closely that may or may not link to your day-to-day symptoms. As soon as we look at the scan, it's very easy to overlay that onto where your symptoms are and assume that they are connected. And what we tend to find clinically is that your symptoms themselves, particularly if you have back pain, may not always relate to the state of your back on a scan. And one of the interesting concepts to sort of challenge that idea is, if you're someone who has back pain intermittently, say you have back pain for maybe a week or 2 and then it goes away for a while and maybe it comes back again, or if you have ongoing back pain but it only comes and goes for periods throughout the day, the really interesting thing about that in relation to your scan is that the nature of your scan probably doesn't change with the pain that you have. So the way that your back looks on a scan would probably look the same on the same scan consistently, whether or not your pain is there or your pain goes away. So we can always ask this question, what is the true cause of your discomfort beyond the structure of your back? Now, it's always really important to understand though that if an X-ray or an MRI has shown that your back looks imperfect, then that clearly is something to remember and respect, because your tolerance to certain things, or your threshold of tolerance, may be slightly reduced compared to the next person if you're loading your back up in a way that doesn't necessarily respect your physiology. So you're bending the wrong way, or you're sitting poorly, or you're moving your back in a way that it doesn't like, your tolerance to those shapes may be less than someone who doesn't have that on a scan. The really interesting thing and crucial thing about this is you don't want to get to the point where you feel like the scan is ruling your life and that you've been given this label, and that because that may not change or may not potentially have the capacity to get better long term, that says the same thing about your symptoms day to day. And this speaks to the exercise that we're going to get to, but it's really important that you can take a step back and understand that yes, that's how your back looks, but it generally tends to be how you load your back up and how your back is functioning in terms of where you're stiff, where you're tight, postural habits, how strong you are, the quality of your bending shapes, how you sit, all of these sorts of things have a far bigger influence on how your back pain feels day to day than what your scan shows. And more importantly and more excitingly, we don't need your back to look better on a scan to make you feel better. So ultimately what I want to get across in this video, in this particular part of the video, is that if you feel your happiness or your stress or your understanding or your expectations of how your back is feeling day to day is very closely tied to what is written on your scan or how your scan looks, then it would be really beneficial to you to try and get to the point where you feel a little bit more disconnected from that, a little bit more connected to the more intangible things like your stiffnesses, your tightnesses, your weaknesses, how you're loading things up, your postural habits, all those sorts of things. They become more important over time because A, you can control them, they are more tangible in that space, and we don't have to rely on that to improve for you to feel better going forwards. So the exercises that I want to touch on, we'll break them down into 3 different sections. Now, all 3 of these exercises are hip stretches. Now, obviously there are a bunch of core strength exercises that are really important. On the channel, I've gone through a number of low back exercises that I find useful clinically, but the exercises that I really wanted to touch on in this video are hip stretches. What's really interesting about what we see on a scan is that the levers of your back that generally tend to become degenerative tend to be the base of your spine, whether that be L5S1, L45, or potentially L34, or even higher, depending on the nature of your back and how severe that tends to be. The point being is that most of the wear and tear that happens in the low back is at the base of that back. And the reason for that, in my experience, is when we're moving and using our body, if we stiffen up the hip joints directly below the back and we're not using our hips to their full capacity, then when we're involved in movements and motions that require more hip range than we currently have, then instead of bending from our hips stop moving, and then the next available movement, the next available joints have to move, which tends to be the low back. Now, obviously, in the spirit of making sure that your back functions as best as possible, the 3 exercises that I want to touch on just tend to hit different aspects of your hip that tend to get tight and restricted and can compromise how you load up your back. This can be a really important piece of the puzzle to allow that tissue to feel better and progress to the point where you feel like you're managing things a lot better as well. So the first hip exercise that I want to touch on is one of my personal favorites, and that's the couch stretch. So again, if you've been a fan of the channel and you've been following for a while, you'll know how much importance I place on this couch stretch and its ability to undo a lot of the sitting and the sitting-based habits that we tend to have day to day. Because what it does is it really goes after a lot of the tissue at the front of that hip through the thigh and potentially the lower abdomen. It really allows us to take that handbrake off to fit some slack into the front of our back. But more specifically, a lot of these hip flexors anchor from your leg and attach into the front of your spine at the base of that spine. So if we are tight at the front of the hips, you can really pull and create a lot more tension through the front of the back, changing the way that we load it up. But just be aware that this particular stretch can be brutal if you let it, but we can definitely find a more respectful version of the stretch. So what we want to basically do here is, if I'm stretching this leg first, we want you to lean forward a little bit and try and get your knee right into the back corner of the couch with your shin relatively vertical. Now you can hold onto the couch if you want to, but the idea here is keeping your back straight. From your hip, we want to gently extend upwards through your hip, not necessarily through your back, until you find a point where you feel a lot of the tightness at the front of your hip, potentially down through the front of your thigh. Now, if this is the first time you've done it and you're expecting to be quite stiff, start more horizontally to begin with and only come to the point where you feel very safe and very comfortable that you can expose some of that tightness. What I want you to do here is, once you're in this position, gently push your shin back into the chair, squeeze your glutes, tense up this tightness as much as you can for about 5 to 10 seconds. Once you release that, you should feel like you've got a tiny little bit more range that you can work back into. We can keep repeating this process until you feel you can get back, until your butt touches your foot, or until you're vertical and feeling relatively comfortable. Once you can get to that point, the ideal that we want to get to eventually is you can do the same thing on the ground. So knee goes back into the corner. We have the other leg up, which can be a little bit tricky for some people. But then again, keeping your back straight, extending up from the hip, and then you should feel like we can really start to release a lot of the handbrakes from the front, potentially the front of that spine as well. But as I was saying, make sure that you feel very respectful when you do that. And ultimately, when you get up and walk around again, you should feel immediately looser straight away. Now, the second hip stretch that we want to attack here in terms of trying to feed some more slack into the lower back revolves around improving your ability to flex your hip. Now, this one's really crucial for a number of reasons, but one of which is, as I was saying before, if you are someone who is bending and leaning forwards, you don't have the required amount of hip range to do that successfully by keeping your back straight. Essentially what will happen is you'll run into the end of your hip range and you'll have to bend your back to make up the difference. And that hinge point will go through the lower back more than it needs to. It's the same thing that we see for a lot of people who have to sit a lot. But if you're sitting at your desk and leaning forward a lot, it may not seem like a savage thing you're doing to your back, but over time, if you have the ability to keep your back straight and lean forwards, no worries at all. Most of this is happening at your hips. But if your hips are tight and you're leaning forward a lot through your back, then essentially, again, you're kicking a subtle hinge into that low back, isolating the load down that area, and setting yourself up for some wear and tear down the track, particularly if it is related to your pain and dysfunction going forwards. So the exercise that I want to get you to do here, and again, you can do this on a chair, you can do it on a couch, I'll do it on the floor as well. But what I want you to do here is we're going to get you to lean forwards, but I want to make sure that we're not just lunging forwards. I want to make sure that from your hips is where the movement is coming from. So as your trunk comes forward, I want you to imagine that you're taking your hip back a little bit, going as far as you feel comfortable. We're looking for some tightness underneath this sort of butt cheek or this gluteal fold. But we just want to maneuver yourself around and taking that bottom away from you to to really tighten up this tissue. Then again, what we want to do, like we did with the couch stretch, we want to squeeze that tissue. You can push your foot back into the couch or the chair, tense this tissue up for a few seconds. When you release that, again, you might find you can go a little bit further than what you could before. Now, the other important thing about this exercise is as you're coming over the top here, if you do feel like it impinges or it catches at the front of your hip, what I'll get you to do is just take your knee out to the side a little bit more, allow that knee to roll out the way of your pelvis and your low back, so you're almost going on the inside of your knee. Now, again, if you want to push this a little bit further, we can do the same thing on the floor. We're going to be up in this high kneeling position. Obviously, you have to have your other leg out the back, but it's the same thing. As you lean forwards, we want you to take your bottom back, have your knee out to the side a little bit so you're not running into your hip. And again, we're trying to find a position where you can keep your back relatively straight as you come forwards. The distance you go is irrelevant. It's all about when you find this tightness. Do the contract, relax, that PNF style stretching. Keep doing that, and then what you'll find is your ability to then bend forward without including your back in the conversation will immediately improve compared to what it was before. So the third and final hip stretch that I want to go through in this video, this one is more of a hip external rotation stretch that tends to target a lot of the muscles that become tight and sore pre-back pain and also during back pain, whether it be that piriformis or some of those hip external rotators. So same thing with all of these exercises. You can do this up on a chair or on a bench if it's worthwhile to you. Instead of putting our foot straight up, we're going to bias the rotation aspect. So what we're going to do is we're going to try and get your knee down towards the chair or the bench, and same thing, we're pulling your bottom back as you're leaning forwards. And what we're looking for is to really target the tightness in your butt cheek. Same deal, give it a good squeeze, let it relax, go a little bit further, give it a good squeeze, let it relax, and keep going as far as you feel comfortable so that you're still stretching that tissue. Now, for anyone else, again, who wants to do this on the floor, and again, all we want to do is we want to really bias that external rotation. So we want to be in this position where we have one leg out the back, and we want this leg to drop as flat as you feel comfortable getting. It will get looser the more you do this. But same deal again, we're taking the hip back away from the knee to really bias that hip. And as we lean over, we're trying to go as far as we can so we find some tightness in this hip joint. Same deal as before, give it a squeeze, hold that for a couple of seconds, then relax. You might find your knee will drop down a little bit deeper. Keep sort of hunting around through that area to find where your tight spots tend to be. But ultimately, by giving you some exercises to address the tissue at the front of the hip, giving you some exercises to address the tightness at the side of the hip, and also giving you some exercises to address some of the restrictions just underneath it, we can start to allow you to feed more slack into that lower back, unload those degenerative areas, those degenerative discs, and hopefully allow those symptoms to free up and get better. Now, as I was saying before, it's really important to keep reminding you that clearly core strength is important for any back issue, as is making sure that the joints and the tissues of your lower back, those facet joints and the joints above it, that rib cage, are also mobile and loose. But by improving your ability to move your hips and how you load your back up, it really creates this really nice platform for progress to occur. I genuinely hope that was helpful. I hope there were some insights in there that you found useful and that some things you can put into practice to genuinely help your symptoms. If you did go on to enjoy the video, please consider leaving a like rating down below. Subscribe to the channel if you're new, if you like this type of content, if you want to learn more things. And if you did find this genuinely helpful and it did help you solve something that you were dealing with, please consider leaving a super thanks donation on the video as well. It's just a great way to help support the channel going forward. With that being said, I appreciate you watching and we'll see you in the next one.